Hey guys, this is Fixer Med. Welcome back to my high-yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering a broad overview of the discipline of anatomy across various organ blocks for these examinations. This will be part 53 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content. Let's start off by taking a look at communication of the paranasal sinuses. Sphenoethmoidal recess receives the opening of the sphenoidal air sinus. Superior meatus receives the opening of posterior ethmoidal air cells. Middle meatus, infundibulum, ethmoidal bulla, and semilunar hiatus receives openings of frontal and maxillary sinuses as well as anterior and middle ethmoidal air cells. Inferior meatus receives the opening of the nasolacrimal duct. Let's next take a look at epistaxis. Epistaxis, nosebleed, most often occurs from the anterior nasal septum, Kisselbach's area, where branches of the sphenopalatine, anterior ethmoidal, greater palatine, and superior labial from facial arteries converge. Let's next take a look at sphenoiditis. The relationships of the sphenoidal sinus are clinically important due to the potential for injury during pituitary surgery and the possible spread of infection. Infection can reach the sinuses through their ostia from the nasal cavity or through their floor from the nasopharynx. Infection may erode the walls to reach the cavernous sinuses, pituitary gland, optic nerves, or optic chiasma. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 35-year-old man presents to the clinic with a complaint of persistent nasal congestion and a dull, aching pain over his forehead and cheeks. A CT scan reveals inflammation in multiple paranasal sinuses. During the examination, the physician explains that the patient's symptoms are due to obstruction of specific sinus drainage pathways. Which of the following is the most likely site of obstruction affecting the maxillary sinus drainage? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is C, middle meatus. The middle meatus is the drainage site for the maxillary sinuses, as well as the frontal sinuses and anterior and middle ethmoidal air cells. Inflammation or obstruction in this area can lead to the symptoms described, including nasal congestion and facial pain, due to impaired drainage of the maxillary sinus. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, the sphenoethmoidal recess is where the sphenoidal sinus drains, not the maxillary sinus. B, the superior meatus receives drainage from the posterior ethmoidal air cells, not the maxillary sinus. D, the inferior meatus is the drainage site for the nasolacrimal duct, which is unrelated to the drainage of the maxillary sinus. E, the nasolacrimal duct drains into the inferior meatus and is associated with tear drainage from the eyes, not sinus drainage. All right, now that we have covered this question, let's move on to look at the next question. A 28-year-old woman presents to the emergency department with a severe nosebleed. She reports that the bleeding started suddenly and has not stopped, despite pinching her nose and leaning forward. On examination, the source of the bleeding is identified as the anterior nasal septum. Which of the following arterial branches is most likely involved in her epistaxis? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is D. greater palatine artery. The anterior nasal septum, specifically Kieselbach's area, is a common site for epistaxis due to the convergence of several arterial branches. These include the sphenopalatine, anterior ethmoidal, greater palatine, and superior labial arteries. The involvement of the greater palatine artery, which supplies blood to this area, is consistent with the patient's symptoms and location of bleeding. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. The middle meningeal artery supplies the meninges of the brain and is not involved in nasal blood supply. B. The posterior ethmoidal artery supplies the posterior part of the nasal cavity and sinuses, but not typically the anterior septum, where Kieselbach's area is located. C. The superior thyroid artery supplies the thyroid gland and nearby structures, not the nasal septum. E. The inferior alveolar artery supplies the mandible and lower teeth, and is not involved in nasal blood supply. All right, now that we have covered this question, let's move on to look at the next question. A 42-year-old man presents with severe headache, nasal congestion, and visual disturbances. On examination, there is tenderness over the bridge of the nose and decreased visual acuity. CT imaging reveals opacification of the sphenoidal sinus. Given the potential complications associated with sphenoiditis, which of the following structures is at risk of involvement due to proximity to the sphenoidal sinus? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is D, optic nerve. The sphenoidal sinus is closely related to critical neurovascular structures, including the optic nerve. In cases of sphenoiditis, inflammation or infection can spread from the sinus to adjacent structures, potentially leading to compression or damage to the optic nerve. This can result in visual disturbances, such as decreased visual acuity, as seen in the patient's presentation. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. The temporal lobe is located within the cranial vault and is not directly adjacent to the sphenoidal sinus. B. While the internal carotid artery courses through the cavernous sinus, which is adjacent to the sphenoidal sinus, it is not typically affected by sphenoiditis. C. The zygomatic bone forms part of the facial skeleton and is not closely related to the sphenoidal sinus. E. The mandibular nerve, trigeminal nerve V3, exits the skull through the foramen oval and is not in close proximity to the sphenoidal sinus. All right, guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is FixerMed signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.